Okay, so April is Autism Month, and we thought that we would have some casual conversation about autism. I'm sitting here with Dr. Elizabeth Lown, and autism just happens to be her specialty. So tell us a little bit about autism.
So what autism is, it is a neurodevelopmental disorder that typically you'll see characteristics in children 2 and older, but we also can see characteristics as early as 12 to 18 months in children, primarily boys and girls, so a mix of both.
And what are some of the signs that you'll see emerging as early as 18 months to 2 years of age?
Yeah, so the main areas that you look for autism is a language. So a language is a big one. So are they communicating? So are they saying single words? Are they putting 2 words together to get their needs met? So it's a communication and a language piece. The second part is the social aspects, so the social performance and their social engagement. Children between 12 and 18 months should be playing together. They should be engaging in back and forth play skills. They should be facilitating interactions with their kids, playing with another child. Joining tension is a big one with children at that age where they should be playing back and forth. So what does that look like? And then the third area is where you have the restrictive, repetitive patterns of interest for children. And usually in the younger kids, you'll see, kids like to play with things in a repetitive manner. So what does that look like? Or they playing with their toy appropriately? Or do they, like to watch the wheels spin on their car? Or do they like to take the car apart and put it back together? Do they have any other repetitive, motor movements? So do they engage in hand flapping or spinning or rocking to self-soothe? So that's a sensory component. So those are kind of 3 areas that we want to look at, to see what characteristics or if a child may be exhibiting some characteristics of autism.
Okay. And then there's also echolalia. Can you tell us a little bit more about echolalia?
Yeah, so that is just a vocal stemming. So there's immediate echolalia and there's also delayed echolalia. So for example, if you are trying to talk with a child, interact with a child, and you ask them a question, they may repeat that question back. And that's that immediate echolalia type language. And then you may have where children have a favorite TV show and they will talk only about that TV show, and they will what we call the script as well. They script they rattle off their favorite TV show. So that can be a form of echolalia language. It's just not really the functionality of the language. It's just kind of rattling off their favorite shows. Or some children with autism love the numbers and colors and letters. So they will rattle off the numbers and colors and letters, but don't use them quite functionally.
So they're not communicating with other people.
Right.
So some who are communicative are speaking, but just not speaking in the manner that you would expect for that age.
Yes, exactly.
And also, what about the kids who do try to socialize with other kids, but do so in an inappropriate manner? Maybe not recognizing personal space. So instead of isolating, wanting to play with other kids, but just not getting the social norms.
Right. So yes, so that's another area. Some children, they want to play, but they just don't they may not have the language to say, play with me, or to tell them their name, or to tell them what they want to play with. So that language barrier is a really big issue for kids that want to try to engage, but they aren't able to because of that language deficit. But also they don't have what comes natural to them, right? So some children, they naturally know how to approach another child and engage in that. But with children that may have autism, that's an impairment.
And what about those kids who are verbal, who have autism, and have difficulty socializing with other kids?
Yeah, so that's a good question, because we typically don't talk about the other side of autism, because it is a spectrum, right? So we have children that are very verbal and they can communicate and they can speak in full sentences. However, their interaction, we don't teach those social skills, so their interaction may look different or may be odd for them to be able to go up to a child and play appropriately and initiate those interactions.
So they want to play and they attempt to, but it just doesn't come across as naturally
right.
or smoothly as it does with other kids without autism.
Right, yes.
Yes, autism being a spectrum disorder. Can you tell us a little bit more about what that means and why autism is considered a spectrum disorder?
Yes, so this is a very good question. So I have, met hundreds and hundreds of children with autism, and when you meet one child with autism, you do meet one child because all their needs are individualized. So you have children that have no language at all. You have some children that can say, 1 to 2 words words to get their needs and wants met. You also have children that can speak in sentences and be able to articulate what their wants and needs are met. However, they may not be able to answer back and forth questions. And they may have some of that language, but they may not be able to use it functionally, such as, what's your name? They may not be able to respond that. They know their name, but they may not be able to respond that fully. And then you also have children that are more verbal and can communicate back and forth, but may have a big social deficit to where they don't have, or those interactions just aren't natural, and they struggle with adapting to their environment and working in jobs that require them to have to interact with others, because sometimes you see children or young adults with autism struggle with connecting with others. They feel like they're just not able to relate or be able to feel the emotion of others and make that connection. So that's a real deficit area for children and adults on the spectrum. So it is a wide range, based on severity. So they have, the mild, moderate, and more severe range. So that's part of the spectrum. So I think that's a great question, because people often look at autism as just severe, and that's just not true. You have children that may be more severe, but may fall more in the middle range, and you have children that fall more in the higher range that are in the gifted. So I think it truly is a spectrum disorder.
And that brings me to think about the term Asperger's disorder. So I think I get a lot of questions about what's Asperger's disorder, what's autism, and it's interesting how we use the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, and they decided to change and go from, instead of having two distinct disorders, Asperger's, which was a higher functioning type of autism, and having autism as a separate diagnosis, to now having just the autism diagnosis, whereas the ICD-10, which is the International Coding and Diagnostic System for disorders in general, not just mental health, but also physical health, and they kept Asperger's. So I think that is very interesting, how you can still have Asperger's if it's diagnosed under ICD-10.
Right.
That brings me to intellectual functioning. So you can also see differences in terms of intellectual functioning or IQ, right?
Right, yes, you can. So some children, with autism do have a cognitive impairment, okay? And then you have some children that may not have the cognitive impairment that have the social deficit, but then you also may have children that fall on the spectrum that are gifted or fall at an average or normal kind of range for cognitive functioning. So you have the different aspects of functioning as well.
So a child who seems to be highly intelligent still may have autism.
Yes, that is correct. And I think, a good point to look at is, like you mentioned, the DSM, the Diagnostic Manual, to look at the criteria for autism does differ a little bit than the school-based criteria. So the school-based weighs heavily on the communication, the social interactions, and the repetitive restrictive patterns of interest. And that kind of gets gray for children that do communicate, right? Because one of the big components of autism is, the communication delay, or just children not be able to use their language functionally. So if you do have a child that's more on the higher functioning end, they may not meet the criteria in the school system, even though they do have autism. They just might not fit in nicely in that category. So it kind of makes it challenging, because some people might question, if my child doesn't meet the criteria in the schools, but they meet it medically, does my child have autism? So I think that brings up more questions, to kind of look at further.
Wow, and we could spend a whole session talking about
yes.
accommodations within the school system and all that goes along with that. Yes. So if someone is seeking assessment for autism, how do you start? What do you do for that process?
Yeah, so the first process is do a parent intake and see, what's the parent's concerns? What does that look like? Did they maybe get referred by the pediatrician because their child wasn't meeting their developmental milestones at those early pre-stages? They weren't quite meeting those yet. So they had some concerns that maybe further increased to where their child wasn't making the progress that they should have been making. Or we see some children that are making progress but may regress in some skills. So they come in, we do a parent intake, I get all the information, developmental history. If the child's in school or attends daycare, we get the daycare history. And then we kind of go through some questions of, tell me about their language, tell me about their communication, tell me what is their interactions like with other kids? Do they have any cousins at home? Do they go to the park? What does their engagements look like? And how do they play with their toys? Do they play appropriately? Are they doing make-believe play? Are they playing back and forth? Are they sharing enjoyment? Are they laughing? Or are they rolling their cars appropriately? What do those things look like? And then after doing the parent intake and getting all that information, we do a child session to kind of see the child and interact with the child and see what does that look like. Let's see what our interactions. This is a new setting. Some children with autism have a hard time going from one setting to another. That's that transition piece. That is hard for children. So we want to see, how does a child come into the assessment room? Are they uncomfortable? Do they need their parent present? Does the child make interactions with you? Does the child want to play and engage with you? Or do they seem to not notice you're there? That can kind of guide further on what assessments need to be done based on that interaction with the child in that child session. So after that, let's say the child does show some characters of autism, then we would consider moving forward with our autism testing that we do.
So if a child does meet diagnostic criteria for autism after your assessment is done, what are some of your recommendations?
Yeah, great question. So I think based on the severity of the symptoms, so, again, taking into consideration the mild to moderate, more severe range, if it's more in the mild range, make recommendations of, social skills. So children being able to engage in groups that require children to get out of their comfort zone and learning how to interact back and forth, how to engage back and forth, how to use their words to be able to make those initiations with other children. And then also for more, mild or more moderate to severe range, we may recommend children seek out ABA therapy, which stands for Applied Behavior Analysis Therapy, which they have several clinics in the surrounding areas that work directly one-on-one with children and provide children those services they need, such as those pre-academic skills, learning to attend and sit at a table and learn, again, some of those pre-academic skills. Also, they can incorporate some social skills too into that. And then also helping them set them up for school, get them school ready for, the smaller children. And then also if, children, if they do seek, some children on the spectrum do seek a medication regimen, paired with autism sometimes comes some inattention, hyperactivity, some anxiety. So that may require some medication to kind of help manage some of those symptoms. Okay, so the medication part, that's in your department. So you do a lot of work with the medication and helping children, with autism or other disabilities that come with autism to help that. So can you give us a little information about that?
Yes, sure. So, there's not a single medication that is specifically for autism. Like you said, it's a spectrum disorder. So some of the individuals with autism may have anxiety, some may have symptoms of ADHD, depression, anger management issues, impulsivity, self-injury. The list goes on and on. Or tics, that's another one.
Right. Yes.
So what I do is once a child is diagnosed with autism, I look at what are the symptoms that we want to manage. And then from there, we'll use the appropriate medications. There is one FDA-approved medication for autism, and that one is Risperdal, and that one is prescribed for children with autism as young as 5. And it really helps with stabilizing mood. I use it more for individuals who have self-injury or, some of them who engage in headbutting or head banging or repetitive picking that can lead to some sores or scabs or what have you. Risperdal is also great for extreme hyperactivity and anger, impulsivity. So that's the only FDA-approved medication for autism. With that said, I often use antidepressants such as Zoloft, Prozac to address symptoms of anxiety. A lot of kids with autism have severe anxiety, as you mentioned. So I'll use those medications or the medications that I would use for kids with ADHD if we're really looking at addressing impulsivity or hyperactivity and sustained attention. So medications like Concerta, Adderall, Evykio, those are the stimulants, and there are some non-stimulant options as well. So just like there's no blood test for autism, there is not a single medication that is specifically for autism that hits all of the symptoms.
Right. So also we're seeing a big increase with autism, right? We're seeing more and more children that are coming up diagnosed with autism. So what do you think about that? Like, what do you make of that?
Yes, we are. And I know that we think similarly on that topic. I don't think that there's really an increase in the individuals who have autism. I think that we're getting better at identifying autism, and that previously there were lots of kids who may have met criteria for autism but just flew under the radar.
Right.
You know, there weren't as many people who were skilled with the diagnostics, and back then they may have just ended up in a special class or even a special home or other settings, and we just didn't know what the proper diagnosis was. I mean, of course, that's one hypothesis. Over the years, there have been a number of hypotheses, you know, such as different products causing autism, red dye, some of the vaccines causing autism. We know now that none of those claims have been substantiated.
Right.
We think that it's something that just tends to be inherited, and it's a neurodevelopmental disorder, not something that is caused by toxins, I guess is what the latest thinking is. I've also seen an increase in the number of adults coming in and wondering if they have autism. And I think that that's because these may have been people who flew under the radar when they were younger, struggled, did the best that they could to get through with navigating, and now that there's more public awareness of autism and what the symptoms are, they're identifying with that and thinking, that might be what I struggle with.
Right.
So I think that at least in part explains why we're seeing an increase in the numbers.
Yes, absolutely. And also I think too, some of these children that you're saying are going under the radar, as they get older, they're learning to adapt, maybe learning some of those skills on how to be social, and some do end up, in a marriage setting, right? And then sometimes the spouse notices some of these characteristics that look kind of quirky, and they're like, something's quirky, maybe the way that they do, maybe it's the way some of their lifestyle is, or the way they interact with their husband or wife, and it may just look different, So also I think others are being able to identify more characteristics and be able to point out some of those things that may warrant the person to seek out, like, okay, maybe I do have some characteristics of autism. Let me explore that. What does that look like?
Good point. Yeah. So it's showing up in relationships,
right?
Where that closeness that you would expect isn't quite there.
Right. Yes.
Well, thank you. You have been
thank you.
an abundance of information. You have provided us with an abundance of information.
Thank you. Yes. Same.